Excellent. Thank you very much. I'd like to welcome you all this evening to our regular, which is fourth in the series, but it's a regular sort of online meetings. We have webinars that have been hosted for our residents and businesses in Harrow. So I'd like to thank you for joining us tonight. My name is Councillor Graham Henson. I'm leader of the council, and we do have a very good panel here tonight to answer any questions that you may have. So I think people are getting a bit frazzled with all the lockdown processes. I'm sort of missing my hair, getting my hair cut, one of the things, and it is quite difficult and challenging, but it's been worthwhile because the numbers are coming down. And on the presentation tonight, you'll see how far that is going and how that is working. But a key component of keeping the infection rate down will be through the vaccination programme, and there's a lot of detail coming through that tonight as well. So the vaccination programme in Harrow has been hugely successful so far. We're leading the way across all London boroughs. The impact of the vaccination, as I said, is evident in the reduction of cases. More importantly, it's a reduction in the hospitalisation and the mortality rate, which are all coming down a lot lower than we had. Unfortunately, very sadly, over 670 people have died in Harrow, directly caused by COVID. And while the COVID cases in Harrow nationally have dropped substantially from the crisis stage a couple of months ago, we are not out of the woods yet. So with the COVID restrictions changing, we need to be alert and continue to practice COVID safely, including the social distancing, the wearing of masks and the washing of hands, and to ensure the number of cases do not go back. We do not want another surge coming through until this one is under control. So I'd like to introduce you to the people that are on the panel tonight. We have Carole Furlong, who's our Director of Public Health. We have Dr. Jamila Sherif, who's the GP from the Pinn Medical Centre. And also we have Dr. Michael Abu, who's a GP from the Kenton Bridge Medical Centre, who deal with all the residents in Harrow. Tonight we will update you all about the current situation, provide more details about the ongoing vaccination effort in Harrow, as well as address any questions and concerns that people might have about the COVID vaccines. Just a bit of housekeeping really before we start, to address some of the functionality issues on this Zoom webinar. If you have any questions during the webinar, there is a Q&A slot, and you can put those into the chat function. You can which is at the bottom of your screen. Your answers will come across to myself and the other speakers here tonight, and we will look to answer your questions, as many as we can. And there is some people also on the call in the background who will give you some direct information to answer those questions. When you're asking your questions, could you please remember to give your full name if you didn't use it when you logged in, and the name of your organisation if you have one, then we can make sure you can keep up to date with this, what's going on. So as we go through the webinar, we will sort of introduce people correctly in how we go through. But first of all, but when we get to the end, we're actually going to be doing a polling again to understand the event, what people thought of it, and if there's any other information needed. So if you could complete that before logging off, be gratefully appreciated. So if we go straight into the agenda, first of all, I'd like to welcome Carole Furlong, who's our Director of Public Health at Harrow Council, who will give you an update around about the effects of COVID currently in Borough of Harrow. So over to you, Carole.
Thanks, Graham. Hi, everybody. So, you see my slide? Yeah.
Yes, thank you.
Yeah. Okay, great. So, I'm going to give you a quick update on where we are in terms of number of cases, and address a few of the issues, and talk to you a bit about the surge testing as well that we're doing. So in the last week, we've had 146 cases, which is a little bit up on last week. But some of that is because we've been doing the surge testing, and we found people who otherwise wouldn't have known that they were positive because they were asymptomatic and have turned out to be positive. So our rate at the moment is 58.1, which is up from about 40, 4, I think we'd gone down to late last week. The good news is that in older people, in the over 60s, the rate is still really nice and low. And the positivity rate is also nice and low, which means that we don't think that we've got a huge amount of community transmission in the borough. So this top graph just shows you where we've been through the pandemic. So you can see the first wave, which seems like a very small blip, even though it was really awful. But we weren't doing any community testing at that time, so we don't actually know how big that peak was. So, you know, we've seen the second blip in October till we had the lockdown in November. And then the huge increase in cases up to the beginning of January. And when we went into lockdown, we've seen that really steep decline. And it's now around the level that it was in October. But we're still quite a long way from it being like these very few numbers that we had last summer. So we're currently getting around 19 cases a day on average, compared to only about 3 or 4 cases per week as we had last summer. And just to remind you that, you know, we still need to be vigilant. We still need to follow hands, face, space guidelines, and make sure that you're tested with lateral flow twice a week if you leave the house, or if you have anybody who lives in your house who leaves the house. So if we look at the age profile, as I said, you know, we're on 50 something per 100,000, and the really good news here is this 80 plus group. And we've only had 2 cases in people who were over 70 in the last week. We'd only had 1 case in somebody who was over 70 last week. And this is because of the vaccine. It can't be because of anything else, because, you know, we've just seen the rates plummet, and that's really good. We're now seeing the rates starting to drop in the people who are over 60, and you know, and so I couldn't be happier with the way that's going. What I'm not quite so happy with is the increasing rates that we've seen in children. So 13 to 17-year-olds who are secondary school children. We did predict that it would go up when they went back to school, and we're hoping that that's going to come down again now we're going into the Easter holidays. And we're also seeing this 18 to 24-year-olds. It goes up, it comes down again, and it looks like it's going up again. This interim data past this red line is interim data. So we're seeing that going up again. Oops. Yes. Oh, sorry. My mouse is being hypersensitive at the moment. So we look at cases by ethnicity. What we can see is the white, Indian, and other Asian groups are around the borough average, maybe slightly below. The Black ethnic group is below average, and because these numbers are in red, we know that these numbers are less than 5 people in the community, and we haven't had any cases in Chinese or Bangladeshi people. Well, Bangladeshi people for ages. We haven't got very many Bangladeshis in Harrow though. What we have seen though is this increase in the Pakistani population, which is a bit of a concern, because that's almost 3 times as much as the borough average. And although it's not a huge community as across the whole of Harrow, it is a concern that group is still going up. And we were talking to the mosque leaders yesterday and asking them to get the messages out to their community as well. So getting tested, as I said, is really important. We have a whole range of places where you can get tested. If you haven't got any symptoms and you have either a child who's at school, or you work outside the home, or you go out to do your shopping, you can get tested. You can also pick up click and collect tests from our centres if you've got kids at home and you prefer to do the tests at home. And a lot of employers will now be able to have kits for their staff. So if you are a local employer, you can sign on the government website to community testing. I think if you look for community testing employers on a Google search, it will bring you up with the government website for that. And you can sign up, you have to sign up before the 12th of April. And anything from small and medium enterprises up to the large employers, including the council. So we'll be doing that for our staff as well. But we will continue to have our community testing available. And we've got the testing venues, which I think I've got on the next slide. We've also got, I think, 16 local pharmacists who are now doing community testing. So you can pop into the local pharmacies and get them. We've got the schools and the care home based testing as well. And we've got the home testing, as I said, for teachers, care workers, secondary school pupils, workplace testing, and all the home testing kits. So we advise people to carry on getting tested. Even if you've been vaccinated, you could still be infected and you could still have an infection that is enough to transmit it to somebody else. So you need to carry on being tested. You need to carry on wearing masks, carry on with social distancing, carry on with the hand washing and all of the other things. So one of the things that has been raised this week is about lateral flow testing. So there's been a number of videos and lots of WhatsApp messages going around spreading some false information about lateral flow tests. So the whole issue seems to revolve around the gas that's used for sterilising the swabs. Is called ethylene oxide. If you're using it in industry and you're exposed to it in high quantities, then it is quite a dangerous gas, and that's why it's very strictly regulated and very strictly quality assured to make sure that the processes don't expose people to this gas. The reason that it's used is when you can't put something into liquid like a bleach solution or something like that, and you can't put it into an autoclave to sterilize it, then because the product will melt or burn, you need to have a different way of sterilizing. And ethylene oxide has been used for years to sterilize medical equipment and consumables, swabs and things like that. When the sterilization happens, it's put into a chamber where the gas is introduced. The gas is then sucked out, and then a number of air washes are put in and then sucked out to try and make sure that as all of the gas and the residue from it is removed from the swabs. So anything that's left on there is in minuscule amounts, and it's not been found to be harmful in those quantities. It's well below any harmful levels. So don't be afraid of doing the lateral flow testing. It's not dangerous. As I said, you know, that we've got all these different places, the St Anne's Shopping Centre, the Temple up in Stanmore, Harrow Arts Centre, the Civic Centre, and now we've got 16 pharmacies all around the area. And if you want to book any tests, you can book them online. or you could just pop along to one of the test centres. If they're not busy, then you should be able to wait to have a test. If you have got symptoms, and that's a fever, persistent cough, or a loss of taste and smell, you should be familiar with those symptoms now. Then you need to isolate and get tested as soon as your symptoms start. And we've got a whole range of places where you can book tests. You book those online through gov.uk, or you can call 119 to get a test appointment. Or you can request a home testing kit. So you will have heard about the fact that we've had some variants of concern, as they call them. They're variants of the virus. It's very common for viruses to mutate, and these variants, the concern is whether they would be more infectious or cause more severe disease, or would respond to treatment, or wouldn't be amenable to the vaccination. And so that's why they're concerning. So the variant that we've identified is the South African one, which is supposed to be more transmissible, but it doesn't appear that it's any more transmissible than the UK variant, which is the dominant strain that is in the UK at the moment. It doesn't appear to give any more severe disease. So we're not seeing increased hospitalizations as a result of it. And there's probably been around 100 cases, I think, now around the country. So all three of our cases have been the South African variant, despite Mr. Thomas MP saying that it was the Brazilian one. I can assure you it's not, it's the South African one. And they were all picked up because we do random sampling of all of the tests. As the numbers have been going down, the random sampling has been getting bigger and bigger. So instead of doing 5% as we were doing in January, we're probably now testing around about 30%. And at the moment, because Harrow has been doing surge testing, we're testing anybody who's positive. Their sample will be going for genome testing to find out which particular virus they've got. There's no difference to the person who's got the virus. The person who's got the virus still needs to self-isolate for 10 days after the date of their test, and all their family needs to self-isolate. Yeah, there's no difference for the people, but there's difference in terms of our response if we find any more South Africa variants. So our rationale for doing this surge testing is if we found a variant, we've been notified of one, then we ask people who are in that surrounding area to get tested. We would also test workplaces and schools, although that hasn't been applicable in any of the three cases. And we would also test any areas or premises or events that they've been to. So we've done door-to-door testing in Headstone North and Wealdstone wards. We've done testing around Harrow Arts Centre, Wealdstone Town Centre and Harrow Weald Town Centre. And today we've started doing our testing in South Harrow. Most of the areas in South Harrow that we want to test will have received leaflets this afternoon, and they'll be receiving kits. Some of them will have received kits already. Some of them will be receiving kits in the next day or so, and then the rest of them will be receiving them on Tuesday. If you get asked to be tested, please take the test. The vast majority of them are going to be negative, but it will tell you whether or not you're positive. So just to reiterate, stay safe. It's my Swiss cheese model. And it's the number of layers that we put in, the number of things that we do to keep ourselves safe. means that the less chance we have of passing the virus on. So physical distancing, hand hygiene, wearing masks, not going into crowds. And even though we've got some restrictions that have been lifted now, so you can meet up to 6 people outside of your household, you should still try and stay 6 feet away from them. You should still be wearing masks. You still shouldn't be touching and hugging. So it's, that. Yeah, but you can meet them, which is great. I'm looking forward. I'm going to my sister's this weekend, so I'm going to see her for the first time since last summer. Also, if you are indoors, then keep your windows open. If you're found to have an infection, then quarantine and isolate, and get the vaccine if you're offered it. Just a few words about vaccination before we move on to Jamila. Vaccination uptake in Harrow is doing really quite well. It's not perfect, and we would like to get everything higher. We've got very high hopes that we will be able to be in the 90% for all of our vaccination cohorts 1 to 9 fairly soon. So we would encourage anybody to get vaccinated. But what we are seeing is that people who live in the poorer parts of Harrow, in more deprived parts of Harrow, are much less likely to get vaccinated than people who live in the more affluent parts of Harrow. So that's one of the things that we want to target. And also in some communities, particularly in the Black community, whether it's Black African community or Black Caribbean community, there is a lower rate of vaccine uptake in those communities. So we would like to encourage people from those communities and anybody who's eligible to go for the vaccine. And I'm going to pass on to Dr. Jamila Sherif, who's a GP at the Pinn Medical Centre, and she's going to talk to you more about COVID vaccination.
Carole, thanks for giving me the opportunity to be here. It's great as a GP to engage with the community at this level. Please can I go to the next slide? So what I want to go through is explaining how the vaccination works and the benefits to increase your vaccination confidence, to address some of the important concerns that women have around fertility, pregnancy and breastfeeding, to address concerns that communities have around the vaccine ingredients, and particularly for Muslim communities is the concern about the vaccination in Ramadan, which is starting very soon on, I think, the 12th of April. Next slide, please. So in terms of how the vaccination works, as we know, vaccination is the best defense we have against serious infections. And the COVID vaccination is like any other vaccination. It teaches our immune system how to defend itself from attack from the virus. The Pfizer vaccination uses bits of the genetic code to cause an immune response. It doesn't alter human cells, and it presents the body with instructions to build immunity to COVID. The AZ vaccine uses harmless virus altered to look like the pandemic virus, so the body can recognize it and then fight against it. We will have the Moderna vaccination possibly coming in the summer, so I've included that there. Currently, we have the 2. So as I said, I want to build the community's vaccination confidence, particularly for some of the groups that might not be coming forward. People have very valid concerns, and it's been shown that if those concerns are addressed and they're given reliable sources of information about how effective and safe it is, that communities change their mind. It's very important to address things people might feel nervous about, address their fears. And these fears might be around the speed of vaccination development or potential side effects. Next slide, please. So the COVID vaccination is definitely the safest way we can protect ourselves and our community. And we've seen that Carole told us about how effective it is. And in the under 70s, we're not seeing any cases. The UK regulator, the MRHA, is satisfied that the vaccination is safe and effective. It passed all the clinical trials and safety checks. the vaccine trials happened quickly, and many people, talk about this. How could it happen so quickly? Were steps missed? No, nothing was missed. It was just that things were being done simultaneously. There was money thrown into it. Checks continue, and that's really important for people to understand. We're continually monitoring, we have yellow cards to report side effects. We're continuously monitoring and seeing what's going on. Independent experts have decided how the best use of the vaccine, who should get it, how it's rolled out. And as we know, millions of people have had the vaccination, and any reports of serious side effects have been very rare. Next slide, please. Next slide, please. So the huge benefits, we know it is slowing down the spread of the virus. We still have to take all the measures, as Carole mentioned, because we still may be able to pass on the virus to others, but it is definitely slowing down the spread. It is reducing the risk of symptomatic COVID significantly, and it's highly effective in preventing those who are getting COVID from becoming seriously unwell, being admitted to hospital and dying from it. So, it's a blessing. In terms of side effects, so vaccinations don't give you the disease. They, as we said, they teach your body's immune system to recognize and fight the infection. A lot of people, it's common that they do suffer from mild side effects. And this is not the disease, but the body's response to the disease. So it's showing that you're having a good immune response. Very common side effects. For example, when I had AstraZeneca a couple of months ago, and for a couple of days, I had a sore, heavy arm, felt tender, I had a headache, I felt tired, I might have had a mild temperature, but those side effects would last maximum 1 or 2 days. If you continue to feel unwell, then seek medical advice. Please go on to the next slide. I will briefly address, I think a lot of people have obviously seen what's going on in the news at the moment, and the fact that Germany has suspended AstraZeneca vaccination in under 60s. So there has been concern about blood clots in the veins. The UK regulator, the European regulator, and the WHO have recognized overall no increased risk of blood clots from AstraZeneca. There have been 37 cases in 17 million, and we have to recognize that, blood clots in the veins, DVTs, are a fairly common occurrence in the population. These rates are far less than would occur naturally. And it's difficult when something's rolled out to millions of people to separate what is going on naturally in the population and might occur after the vaccination, which has nothing to do with the vaccination itself, but is occurring naturally in the population. There have been reports of very rare cases of unusual blood clots occurring with lowered platelets. So platelets are the components in our blood that make the blood sticky after vaccination, and I'm sure people have read this in the media. These are reported in less than 1 in a million people vaccinated so far in the UK. This phenomenon can occur naturally, and there's no established cause that is the vaccination itself. As a precaution, the UK regulator has advised that if you have symptoms after 4 days of a headache or bruising somewhere else apart from the vaccination site, you should contact your GP. What I want to reassure people that headache is extremely common after the vaccination, but it will be a headache lasting 1 or 2 days. Keep well hydrated, so drink a couple of liters of water in the day, have some paracetamol, have ibuprofen. If your headache should get worse, if it's a headache that's worse on lying down, if you have weakness, numbness, neurological signs like blurred vision, confusion, then seek medical attention, call your GP or call 111. So I want people to be reassured but clear about when to seek help. Next slide, please. So another very common question people ask, that I hear my patients ask, so I've had COVID, do I need to get the vaccination? So yes, that's a definite yes, you still do, because your natural immunity only lasts some months. I think it's shown to be 6 months, and you'll get far more protection from the vaccination. people, well, the other concern is long COVID. So long COVID is symptoms that people have that are ongoing 12 weeks after COVID. So commonly people report tiredness, it might be shortness of breath, chest pains. It is okay to have the COVID vaccination if you're having sort of long COVID symptoms, if you're not severely debilitated by those or currently under investigation. It's fine to have the COVID vaccination. You should have the vaccination 4 weeks after having COVID or testing positive for COVID. And that's because some of the symptoms of COVID might be there even after 2 weeks of first symptoms of first infection, and that it would be difficult to differentiate what are the side effects from the vaccination and what are your symptoms of COVID. So you should wait 4 weeks after you first develop symptoms of COVID to have your vaccination. Next slide, please. So there's huge concern about fertility, pregnancy, breastfeeding. There is no evidence that COVID vaccination will affect fertility. There's no biological mechanism or way that the vaccination could impact on fertility that we know of. Women who have had the vaccination have become pregnant. There were theories initially floated about that immunity to the spike protein of the Pfizer vaccination could lead to fertility problems. This is not supported by evidence. If this was an argument, then COVID illness, the COVID illness itself would cause fertility problems. There's no evidence of that at all. Next slide, please. So in terms of pregnancy, there is no known risk associated with giving other non-live vaccinations to pregnant women. So, women routinely have the whooping cough vaccination or the flu vaccination. Vaccines do not contain ingredients that are known to be harmful to pregnant women or to the developing baby. We don't have specific data yet about safety of the COVID vaccination in pregnancy, and that's because the trials were not conducted in pregnant women. So because of that, routine use of the vaccine is currently not recommended, but it is offered to women who are high risk of catching COVID. So that's women who work in the healthcare professions or social care workers, and also women with underlying conditions, for example, diabetes, that would place them at high risk of getting seriously unwell from COVID. COVID trials in pregnancy are planned very soon. I think 3 lots of trials are planned. And so watch this space. I think the situation will change and women will be being offered vaccination in pregnancy. Next slide, please. So I just wanted to talk a little bit about COVID-19 and risks to pregnancy. So if you're a woman, so gestational diabetes, so diabetes in pregnancy is very common. So if you're a woman who has that, or a woman who's highly obese, then you are at risk of serious complications from COVID. You'll be offered the vaccination. Black pregnant women are 8 times more likely to be admitted to hospital with COVID-19. And I'm saying these things because I want those women who are advised and offered the COVID vaccination to come forward and have it to protect themselves and their baby. In the later stages of pregnancy, women who are at increased risk of becoming unwell with COVID. And if this happens, they're 3 times more likely to have a baby that's born prematurely. Next slide, please. So in terms of bearing these things in mind, the timing of vaccination in relation to pregnancy, there's no need for a pregnancy test before vaccination. So that these are very common questions that people ask, or we're planning to conceive, or so there's no need for a pregnancy test before vaccination. Women planning a pregnancy do not need to delay it. If the first dose of the vaccine is given before you realize that you're pregnant, there's no harm, the risk of harm to the baby is very, very low. If you become pregnant between doses, so that means you have your first dose and you become pregnant and you're wondering about your second dose, then you've got 3 options. You can have it at your recommended interval of 11 to 12 weeks. You can wait until after 12 weeks of pregnancy, and that's because the first 12 weeks are the most critical in the development of the baby. or you can delay it after pregnancy. So you've got 3 options there. Some women may wish to delay pregnancy until after vaccination becomes available to them, and because they don't want to risk becoming unwell with COVID in their pregnancy, bearing in mind some of the things that we've said. In terms of vaccination and pregnancy, I think what I'd advise, and this is from looking at the Royal College of Obstetricians and Gynecologists, I mean, it's safe to have it at any time in pregnancy, but probably the best times would be after the 13 weeks, so once the critical period for development of the baby has passed, and before the 3rd trimester, so before 28 weeks, because that's when women can become seriously unwell from COVID. And the other question is which vaccination, either vaccination would be as appropriate. Breastfeeding. So initially we know, breastfeeding was a no-no with the vaccination, and that changed. Breastfeeding is fine with the vaccination. Don't stop breastfeeding to have the vaccination. Although there's a lack of safety data for these specific vaccinations and breastfeeding, there's again no kind of plausible way that we know that this vaccination ingredient would pass to the baby in the breast milk, because there's no harm that we know that would come to the baby. So yeah, so don't stop breastfeeding to be vaccinated. And if you're invited for vaccination and you're breastfeeding, go ahead and have it. So concerns about ingredients, and this might be to various communities, to Hindu, Muslim, Jewish communities. The vaccinations do not contain any animal product or egg. There's no porcine components. The AZ vaccine, so this might be a particular concern to some Muslim communities, and I know people have raised this question. The AZ vaccine contains ethanol at an amount that is less than what is found in natural foods or bread. And Islamic scholars have deemed the vaccine to be permissible as the amount of ethanol is negligible. And so now coming particularly to Ramadan, because again, this has been voiced as a concern. Taking the vaccination does not invalidate the fast, according to Islamic scholars. And that's because it's not the route that would invalidate fasting. It's not an oral route, and it's an intramuscular injection. It contains no nutritional component. It enters the bloodstream, but it is not of it's not of nutritional value. So do not delay your vaccination on account of Ramadan. Many people will be invited for their 2nd dose in Ramadan, so please don't delay it. People might be worried about the side effects and whether that will affect their fast. So if it's mild side effects and it's just lasting a few hours, then continue to fast. If you're having more serious side effects, you're feeling unwell, so if you're having a temperature, a severe headache, it's important then you break your fast, you hydrate yourself, you take some paracetamol or ibuprofen if that's appropriate for you to take. And then you start fasting again once you're feeling better. Thank you. So that's the end of my slides.
Thank you very much, Jamila. There's a lot of information that have been provided there, which has been very useful. And these slides, I think the information will be available on the council website afterwards, so people can look through. We also got a question and answer session coming up in a moment after we've introduced Dr. Michael Abu, and then we can come back to the questions and answers at that stage. So Michael, welcome to Harrow this evening. It's Genevieve. We've been joined by Dr. Genevieve Small as well tonight, which come from...
Dr. Abu, you have to unmute yourself.
Do that all the time. Thank you.
Oh, there you
Can
are.
you hear me now?
Yes, thank you, Michael. Yeah.
Okay. Thank you very much, Chair and fellow panelists, for inviting me to this meeting to discuss the COVID vaccination. I think it's a huge opportunity for Harrow and Northwest London to reshape the inequalities in healthcare and social care. I would start with. Most of the people I've spoken to and dealt with, their issues are very historical, religious, cultural, and it is hard to decipher what is influencing what. Many are influenced by their churches or places of worship. And I thought we made a fundamental mistake. I'm sorry, this is not criticism of anyone. That allowed social media to be miles ahead of us before we started playing catch up. So the social media got out there to these people and we started trying to unwind or undo what social media had done. I get asked all the time that how come I never had my flu vaccination and no one asked me? And now it's coronavirus and people are after me. I don't understand it. I get asked about, okay, HIV, I think it was on the news this morning, that nothing has been done about it. Malaria, nothing done about it. Housing support. So I can go on and on and on about this. We looked at the data that Carole shared about people in deprived areas of Harrow not taking up the vaccination, and I think that is real. They've got real anxiety and fear and anti-establishment. I think this is a huge opportunity for us to work alongside them, to undo some of their beliefs, and hopefully we'll move forward. Now, my personal take on it is that I've had both my doses, and I haven't gone to any harm at all. So my advice to anyone that listens to this is, please, if you're offered the vaccine, go and get it. It won't do you any harm at all. And Jamila, Jamila and Carole, you're a tall order to follow. You've covered a lot of the questions already, Jamila, in your presentation about pregnancy. All I can add to that is that any woman who is either pregnant or contemplating pregnancy, do make an appointment with your GP and go and have that discussion. And if you're pregnant already, maybe have that discussion with your obstetrician. I think I'll stop there. Okay, yeah, I'll just quickly mention something that I read somewhere recently, that even in America, apparently some American bishops are totally against a type of the vaccination, of the vaccine. Why? Apparently it's alleged it contains aborted fetal tissue, which is not true. And a lot of this is going on through the houses of worship. I listen to the Nigerian Pentecostal churches all the time, and I hear what they are saying. I would say majority of it is unfounded, and it could be worded differently. So for us to move forward, my recommendation would be we'll have to engage the leaders, the community leaders, and the leaders in the places of worship. Once I was involved with HPV, which is the human papillomavirus vaccination program in Nigeria. And the key lesson I learned from there, when as soon as I got there, they told me we've got to invite the imams, the bishops, all the churches to participate in this. Otherwise, you're getting nowhere. And I think it's true here with the coronavirus. I'll stop there and take any questions.
Thank you very much, Michael. Gratefully appreciate it. There has been a number of questions that come through, and if anyone does have them, if you put them into the chat on the right-hand side of the screen, there is some people answering individual questions, but there's a flavour of questions coming through that I think we need to address head on, really, so bring them all together. So one of the key ones is around the perceived shortfall of vaccine that's available, and people's second jab being sort of postponed or cancelled. And there's some concerns about the vaccination centres not opening or closing at certain times. Just want, if anyone wants to come back in to really answer about the second jab, the availability, how it can be booked, because there's concerns, you know, that they get a notification that their second vaccine has been cancelled, and it's how they make sure they get they do get the second one, and how long can it be left for before they get the second one. Is
it okay if I answer that one?
Of course, Genevieve. Welcome this evening.
Thank you. Apologies for being so late. Hello, everybody. I'm Genevieve Small, Chair of House CCG, and I thought fantastic contributions from my two colleagues, but I just thought I'd perhaps explain this one, because this is actually caused by a decision that was made at a Northwest London level, so maybe easier for me to explain that one. The people may remember when I came and did one of these a few weeks ago, people were asking, why am I getting my vaccine booked in one centre for my follow-up appointment, and why is that not happening in the other centre? And that was a very real concern for people, because people were worried, why didn't they have their second dose appointment? And at the time I said it was just the way that each of the different centres had planned to do their second doses. Now, when the decision was made in early January to, well, actually the end of December, to increase the interval from 3 or 4 weeks to more like 10 to 12 weeks, we in Northwest London decided that we would suggest to our GP colleagues that we would book the next appointment at 10 weeks. So that's when people, when they did get their appointment booked, had their appointment booked at 10 weeks. But actually what the government decided when they decided to roll out the packs of vaccine for the second doses, they decided that they would actually give those doses at 11 weeks. Now, you can imagine that that has caused quite a lot of confusion, because we are literally having to cancel everybody for 10 weeks and rebook them 1 week further on. Now, that is nothing to do with the GPs. It's nothing to do with the fantastic sites that everybody's running. It is purely to do with the fact that that's when the vaccine is being delivered. But everybody who has had their first dose has absolutely got a second dose earmarked for them. And there's no concern about there not being that second dose. It's just that it's a timing issue of how the vaccine is rolling out. So if we had had the ability to guess into the future, we perhaps could have booked everything at 11 weeks, but we just didn't know that. And I'm full of admiration for my colleagues who are spending hours on the phone and hours communicating with people to rebook them. And I can only apologise for the confusion that this has caused everybody else.
Thank you very much, Genevieve. I think the NHS should be applauded for the way they've ramped this up from more or less zero. So many people being vaccinated so quickly and being organised in a sort of very structured way. And of course, there's been some delays for some people, possibly through the system, but it's how we dealt with that. And I think Genevieve's explained that really well and gives some confidence to the system, you know, that you will get the second jab. It will happen. You just got to make sure it's booked, and it will take place. We've had a couple of questions coming through around the variant. I'll just say that the doctors today who are on the call today have been working all day, and Genevieve's still at work, and come along to things like this tonight. And they don't do that out of just to come and give that advice that you can genuinely ask from GPs, and your own GP would give you very similar advice, or same advice really, about the vaccination itself, the importance of having it. And I'd like to thank the 3 GPs who come along tonight in their own time to try and sort of dispel some of these myths that are taking place. So we do have some questions around the variant. That was from Carole's presentation earlier on. It's just really, Carole, around the numbers of people who have been tested positive with the variant, and has there been any more found in Harrow since we've started this surge testing?
Where to start? We were notified about the first variant weeks after it had happened, because it does take some weeks to actually process the genome sequencing by the laboratories. And what we've done with because we were notified of the second one when we were just about to start doing the first one, we sort of rolled them together. So in those 2 surge testing exercises, we've tested around about 6,000 people with a PCR test. We did do it in two different ways. We did some door-to-door testing, and we did some leafleting and set up a testing centre at the Harrow Art Centre and asked people to go there. And we had two pop-up units, one in Wealdstone and one in Harrow Weald. The reasons that we did this is because around the country, people are trying different ways to see which ways of doing surge testing works best. So we selected slightly smaller areas around the address and picked up some of the areas where people had said they'd been shopping. So we'd identified some shops in Wealdstone High Street, in Harrow Weald, and up at Hatch End. So we leafleted those areas and tried to get people to come in, and that was quite successful for people who lived in Hatch End. And it wasn't very successful asking people from Harrow Weald to go over to Hatch End. So that's why we put the pop-up there. And then we had a really good uptake from the pop-up in Harrow Weald. So we're trying different things, and we'll be evaluating, which work best. We think that the door-to-door testing works best because when somebody comes to deliver your test and you've got any questions about it, they can actually answer the questions because they're all well briefed, understand why we're doing it, and if you've got any questions that they can't answer, then they field it back to me, and I get a little list of queries at the end of the day. So out of those 5,000 tests, we didn't actually pick up very many people who were positive. I know at the end of last week, we had around 9 or 10, and we won't know for a few weeks whether they were the South Africa variant or not. But I can say that in other parts of London that have done this testing, there's been, I think, three or four boroughs that have found additional cases as a result of doing their surge testing, but the majority of boroughs have not found any additional cases. I think we're unlucky that we've identified 3 in close succession, but I think this is probably what's going to happen for the future. If we can get the number of cases right down of any coronavirus, then we can be much more proactive in trying to find additional cases. I'm not overly worried, and I am a worrier, so I'm not overly worried about the numbers of cases that we're finding, because, as I said, the number of people that are testing positive is very low. And we'll see what happens with this next one, but I'm not trying to sort of fudge the issue, but as soon as we've got all of the data through, because some of the testing for Harrow Weald was only finished in the last 2 days, so I can't give you exact numbers, but we will be doing a report, and it we'll make sure that's on the website, and probably at the next community seminar we'll be able to give you a better update on the actual numbers.
Thank you, Carole. Some other questions have come in around the side effects element of it, and were asked the GPs. I remember my wife had, as a frontline worker, had the vaccination, no side effects whatsoever. When I went and got vaccinated, I just had a headache, and as people said, just have drink a bit more water and some paracetamol. But people are concerned, if how long the side effects carry on for, or if they do carry on, or is there anything else they could really do from a GP point of view, because people, if they're concerned, what should their next steps be? So did Dr. Jamila, Mike, or Dr. Michael, did you?
I thought Jamila covered it very well in her slide. Your side effects of very sore headaches, aches and pains all over the body should not last more than 48 hours. Anything outside that, you should be speaking to your GP or 111.
Excellent. So if anyone, if the side effects go on for longer than, or if they have symptoms of something that goes on much longer, then they should contact 111 as normal.
That's right, or the GP.
Yeah, or contact the GP and just have that online appointment. Thank you very much. There's not many other questions. They're very similar around the rescheduled of the second jab. A lot of questions come through about that, but Genevieve has answered okay already. I'm just looking through. If anyone's got any other questions they can see that have come through, then you can pick them out, and if you could answer them. So there's one question that's come through. I'm looking at different screens at the moment, sorry. So there's some questions come through about guaranteeing a second appointment, but that is going to be guaranteed, isn't it? If you can't get through on the website or you can't get through on telephone, phone your GP and they will make those arrangements for the second jab. Would that be correct? All our doctors are nodding. I like that. So is there any summing up of the parts we have from this evening, from the three doctors or from Carole?
And Graham, there was a question about vaccination rates and infection rates in Indian and Pakistani communities. And the Indian community in Harrow have got, I think, the highest vaccination rate, regardless of which age group we're looking at. And in the Pakistani community, we know that generally, if we look at across London, the Pakistani community have relatively low rates, but compared to those low rates across London, the Pakistani community in Harrow have higher rates than the London Pakistani rate, but it is generally a bit lower than the Indian community. But yeah, so it is a bit lower, but not significantly lower.
Carole, I think my only suggestion to tackle that problem is maybe having pop-up clinics in places of worship. I think we'll really get, as the lockdown eases up, I think we've got to really focus on that. Yeah,
and certainly that was one of the suggestions that the leaders of the different mosques in Harrow were suggesting yesterday, and saying that they've got a lot of space in the mosque, and they'd be more than willing to open those spaces up to do vaccination clinics, which I think would be something definitely to consider. I think that would be a good idea.
I think it's been done in quite a few areas, that a pop-up vaccination clinic in the weekends prior to Ramadan coming, for the over 50 groups. I think that would be a great idea, and I think there's some members of the Somali Haswa community, and they're agreeing and suggesting that would be a good idea.
Yes, thank you. It's been these webinars are very informative, and you always come up with new information. I think people are getting ready to get more out into the community. It started this week. The roadmap is sort of saying that from the 12th of April we can get more freedom, and probably in May and June even more. That only works if we sort of maintain the social distancing to get the virus levels down, but also that the vaccination program continues to make sure that it reduces the risk of those people ending up in hospital, which is quite a serious situation to be in. And the health service is sort of preparing if another wave was to come through. So it hasn't really gone away, the virus. And the vaccination doesn't stop the virus, you getting COVID either. It just reduces the symptoms down to quite a manageable level. A relative of mine who works at a hospital had COVID and remembers it quite well, had been out of operation for about 3 or 4 weeks and went back to work. He's vaccinated a few months later, just before Christmas. But when he got COVID again, the symptoms were a lot milder, more manageable. And I think, it's making sure that even though you are vaccinated, that people do still get tested if they're in frontline work. If you're out all the time, make sure you're sort of tested and sort of not hibernate, but sort of keep, sort of be protection of yourself and your family and friends by sort of self-isolating as appropriate. The vaccine is the thing that can actually reduce the symptoms down. Genevieve, did you want to come in as well quickly?
Not on this. I just wanted to make a point, which was to say that for anybody whose friends or relatives or loved ones who are in that top 9 groups haven't come forward yet for their vaccine or haven't heard yet for their vaccine, I would encourage those people to make contact with their GP or by phoning 119 or going on the website, because they will be able to book that appointment now. We have an expectation from the government that by the middle of April, everybody in those top 9 cohorts, so that's everybody aged over the age of 50, or those people who have an underlying health condition, that they should have their vaccine by that date. So we're really keen to make sure that we put that offer out there for everybody at this particular moment. And I think that sometimes people don't realise that because they feel completely well, completely healthy, that underlying health condition will entitle them to a COVID jab. So it's just a little bit of promotion for people, so that get talking about this in your communities if you can, so that people know that they can come forward at this point and they shouldn't feel that they've got to hold back.
Genevieve, in fact, can I just ask a question? Because one of the things that has come up a number of times is people who have relatives who are visiting from other countries who are not able to go back at the moment, and who are in that high risk group, over 80s or over 70s and long-term conditions. And they're finding it difficult figuring out how to get the vaccine without being registered with the GP.
Yes, so they absolutely can have the vaccine. One of the pieces of information that we usually use to record the vaccine is, of course, the NHS number.
Oh.
We've seen.
Genevieve popped off it.
That's the thing with
So does she want to stop the meeting now?
Now we are going to stop now, because I think we've gone through all the information. But I think just to finish Genevieve's point, there is quite a few people who don't have recourse to public funds, or maybe not registered with a GP or doctor locally. We still get vaccinated, and there's a number of routes to do that, either through the local GP, local medical centre, or through the online. And it's not linked to the Home Office as a question that has come up before. It is, the priority is to get people, ensure that people are vaccinated through the right schedule. If the question that is coming back though is around this second vaccination, and we couldn't be clearer really, that if someone is coming up and they can't book an appointment, contact your GP and they will arrange it for you. And if you're uncertain about that, it's best to go through your local GP and just say when you was last vaccinated and you're having trouble booking appointments, and they will organise something and they can access the system and book you in a location.
Graham, can I just say there was a question around the efficacy of the vaccine, the second vaccine, if it was taken at 13 weeks instead of 12 weeks. Carole, can you address that at all?
I mean, we're going to try and do all the vaccines within the 12 weeks. I'm not sure exactly about the efficacy at 13 weeks. I should imagine that it's not going to be that much different to 12 weeks, but but I think we will be aiming to get everybody done by the 12 weeks. As Genevieve was saying, initially everybody was being booked for 10 weeks. Now we're trying for 11. So hopefully we will get it done before 12 weeks.
Thank you.
Excellent. Thank you very much. The other questions are being answered. The information will be on the council website as normal. Carole will be uploading that, probably sending it through to be uploaded tomorrow. I'd like to thank everyone for coming along this evening. I think it's been very informative and to allay some of the fears around, mainly around the second jab, really, the people who have been vaccinated and waiting for their second one. But I think also we need to start talking to people to try and get their first jab as well, to make sure that they are protected. It can be quite easily that if people do become overly ill that quickly again, and we could see the hospitals overrun, and that puts everything behind. The hospitals are currently working very hard to try and work through any backlog of any people waiting for sort of operations or surgery that they've been looking for some time. And they're working that to get through the system. We don't want to delay that recovery with more people going into hospital because of COVID, because they've sort of get that ill again. So I'd like to thank, especially people taking their time out tonight for coming along. I'd like to thank our panel for answering the questions that have come through, and they've been also answering some directly on the Q&A session. And we will be looking to respond to those, any that haven't been answered yet, over the next, by tomorrow anyway, just to make sure you do get a response. So if you've got an email address there, that will be sent back to you. I'd like to thank everyone for coming along, and also for Sudesh for hosting it all to make sure we all stick to time. I think it has been very informative, and if anyone does have any ideas or suggestions of what would be helpful coming forward, then please do get in touch, and we will look to see what we can do to try and get the message out to where we need to do. So, well, it's Easter now, so we'd like to wish everyone a very happy Easter next week, but also Ramadan, and we also have all the Jewish festivals coming through as well, and we also have the Hindu the holy events this year. It's sort of some things we see online now, and we're all looking forward to getting back to normal, back out into the crowds and meeting people again. But we do need to make sure it's in a safe environment and we can protect people. So thank you for this evening, and we'll see you all soon. Thank you.